We've released the guidance on gender identity as a protected class, consistent with the legislation that was passed. Those guidelines are generating a fair amount of interest from folks who think that the guidance is not well thought out to folks who have absolutely applauded the guidelines. I want you to know that in generating the guidance, we drew heavily on folks who have experience in schools working with students of various gender identities, including school principals, including superintendents, including the Mass Interscholastic Athletic Association, the Secondary School Administrator Association, as well as a variety of other groups. And so these guidelines are not something that we sat in this building and dreamed up on our own. These are guidelines that reflect the wisdom of folks who have been confronting these issues and working through these issues in the schools over the years.
Welcome, Brian.
Thank you. I know you're busy. I won't take much time. My name is Brian Kamiker. Our pro-family group, MassResistance and Parents' Rights Coalition, has been active in Massachusetts for over 18 years. I wrote the Parental Notification Law, Chapter 71, Section 32A, which passed in 1996. In the late 1990s, I also worked closely with Dr. John Silver, who was chairman of this board, on similar issues. We've done an exhaustive study of the transgender law, which was passed in the middle of the night with no debate allowed by the legislature, and we studied the regulations and guidelines regarding it, which is why I'm here. Since posting it on our website, I've been on many national radio shows and gotten phone calls from as far away as Europe. Parents hate this. I'm not exaggerating to say that the legislature and this board have become an international laughingstock over this. Gender identity and the other so-called queer theory constructs that you reference are all medical quackery. But despite the so-called experts that you may have worked with, but as lunatic as the law is, it's actually fairly narrow regarding schools. It just adds gender identity to the laundry list for non-discrimination regarding courses of study and privileges. As your guidelines admit, the minimum requirement is updating policies and handbooks. But instead of stopping there, you've extended it in absurd and ridiculous directions. Children self-diagnosing their gender identity without parental involvement, changing children's first names and the pronouns people have to use for them, changing their sex designation in official school records, discussion of gender transition, including hormones and body mutilation surgeries, transgender diversity training for kids and staff with no tolerance for anyone's natural discomfort with this, removing gender from school activities and instruction, discouraging kids from wearing gender-different clothing, and using the outrageously unscientific GLSEN climate survey to defend all this. This is your vision of Massachusetts schools? It's insane. First of all, a person's biological sex does not change, and all the diversity training about assigned sex at birth won't make any difference. But more importantly, you're doing a lot of harm. The mental health profession recognizes this as gender identity disorder. Encouraging it in children instead of giving them help causes big emotional problems down the road, not to mention the trauma to other students. I have talked to young adults who got involved with this behavior early on, and thankfully there was intervention and they're living normal lives now. There's a man, Walt Heyer, who lived as a woman and wrote a book about how it affected him and others he knows. It is very chilling. You should read it to see what you're doing. I will leave a copy for you, and I'll just wrap up. When Johns Hopkins University shut down its transgender clinic years ago, the director, Dr. Paul McHugh, said, quote, "I have witnessed a great deal of damage from sex reassignment, prolonged distress and misery. We have wasted scientific and technical resources and damaged our professional credibility by collaborating with madness rather than trying to study, cure, and ultimately prevent it. You need to revisit this, and not with a bunch of radical activists and so-called experts, but this time with normal, sensible people. And if you don't, the outrage from parents will not stop. Thank you very much.
Thank you for your comments this morning.